You guys, right now, today, we're going to talk about stress and mental health. I think we can all relate to stress and mental health, right? This is chapter 19 in your book, if you want to follow along. But stress is a natural part of life. It's one of the most complex concepts in health and nursing. I think stress can affect, any part of nursing. It can affect any different type of disease process. It can affect family relationships. Stress can really wreak havoc on a lot of things. In early childhood, it can be unresolved. The book talks about it can lead to issues later on in life. I think maybe you guys have seen some of that in the pavilion when you're going, as far as those kids and what they're going through. It can be associated with the development or exacerbation of symptoms of mental illness. So this may be what leads to a psychotic break, unresolved stress. Okay. It can also be a positive experience. I think we've all been in situations where we're stressed because of something good. Um, for example, I know I talk about my family a lot, but we use the term pressure is a privilege in our family. And we use it with sports. So if you're feeling pressure, because my kid's a pitcher, so if you're feeling pressure on the mound, that's a privilege because you worked hard to get that starting spot. So in that situation, pressure is a privilege. Okay. Because you worked hard, you're in that spot, and now you're feeling pressure. Okay. Same thing could be said with you guys. You guys worked hard to get here, right? How many people did you beat out for your seat? And it's a privilege for you to be here. And the stress that you're feeling to become a nurse is a privilege, and that's good stress, right? I know it doesn't seem like good stress, but stress can be a good thing. It can be because of good things, I guess, is what I'm trying to say. Your book talks about, these are some vocabulary words out of your book. Homeostasis, you guys know what homeostasis is. It's what keeps our body in balance, right? And then allostasis is how the body adapts to physiologic stability. The book talks about acute stress and then chronic stress. So acute stress is fight or flight. You're in a situation, something happens, and we gotta make a decision right now. What happens during fight or flight? Well, you have an increased glucose, increased cardiac output, increased oxygen. I mean, your body is just ready to go. Increased energy and increased blood flow. However, chronic stress can cause a lot of wear and tear on the body. Your book talks about allostatic load. So that's the consequence of the wear and tear on your body and brain. And if you look on page 283, it actually says, as wear and tear on the brain and body occurs, there's a corresponding increase to the allostatic load. The greater the load, the greater the state of chronic stress, and ultimately the more negative changes in health. So if you have chronic stress and you let that continue to wear on you, you're going to have more issues from it. It's going to cause issues. Consequences of chronic stress. I mean, the immune system can be compromised. We can have weight gain from chronic stress. This is often associated with depression in Black men and white women. And they talk about the stress model. Stress can trigger the development or exacerbate an illness. I think I already mentioned. So stress can be, the reason why they have a psychotic break. So psychosocial perspectives of stress. Your book talks about different personalities, and this is on page 286. Different personalities and how it can affect stress and whatnot. And I've always said I'm type A, and I do identify with a few of these, but some of them I feel like I don't. These kind of vary from, I think, what we're used to saying type A and type B. But type A, they say they engage in risky health behaviors such as alcohol and smoking. They're very competitive, aggressive, hostile, ambitious, and impatient. I am very impatient. Type B, they're more likely to practice preventative care. They're accepting and relaxed. Type C, difficulty expressing emotion. They may be introverted. They're respectful and compliant. And then type D is distressed. They have negative emotions. So I thought that was interesting. Social aspects or social networks. This is also on page 286. So these are linkages among a defined set of people with whom an individual has personal contact. So how do the people you're around affect your stress level? I think you can say right now, there's probably certain people in your class that do affect your stress level, right? I can say that sometimes there's people I work with that affect my stress level. So they talk about these 3 different levels. Level 1, close contact, so 6 to 12 people. These are probably people you go to school with and your family. These are people you're around frequently. I wrote down family and work. Level 2, 30 to 40 people. So people you see regularly. I wrote down work and I wrote down church, things like that. You see them on a regular basis, but maybe not every day. And then level 3 is like people you see at the grocery store, maybe your mail carrier, maybe whoever checks you out at the dining hall. You be 700, I mean several hundred, sorry. Not very far in, I'm already having trouble talking. So the point I'm trying to make here is there's different levels, and a person can have a large, complex social network. We can have all kinds of people. You can reach people on TikTok, on Instagram, wherever, okay? You may have a large, complex social network, but you can still have hardly any social support. So it's really important, that we dig into our patients and what kind of social support that they have. Do they have this emotional support? Do they have tangible support? Do they have information? Do they have access to these things? Cultural factors. The example your book gave was a person can stay in an abusive relationship to avoid the stress of violating a cultural norm that values lifelong marriage. So maybe someone is in a very abusive relationship, but they know that it's very frowned upon by maybe their family or their church, etc., to be divorced. So they're going to stay in that because of that. So that'd be a cultural issue. Employment factors. I mean, when you're employed, that means you're financially set, right? You're financially okay. Work offers status, regulates life activities, permits association with others, and it really provides meaning. There is a table on 19.3. It's a very large table, but it's recent life questionnaire that you can go through, that we can ask people. It's not even really, I guess you do ask them, but they get points based on what's happened. So maybe death of a spouse, you get 105 points for that. That's a lot. But maybe you change your sleeping habits. That's only 31 points. So you can go through that and see where somebody would score based on what they would answer. Responses to stress. There's emotional responses, but there's negative emotions, positive emotions, borderline emotions. So if you're having stress and you get a negative emotion, that's like anger, fright, anxiety, guilt, shame. Positive emotions, maybe you're happy, pride, relief, you feel love. Borderline emotions, hope, compassion, empathy, and sympathy. And non-emotions are emotions that are too big to fit in any category, maybe confusion or excitement. Coping. There's some good examples of coping on page 290. Problem-focused coping, emotion-based focusing. You guys, this is bad. Emotion-based focusing. Coping. Oh my goodness, I can't say it. Coping is deliberate. It's planned. It's a psychological activity to manage stressful demands. So positive coping leads to adaptation. We've talked about coping mechanisms before, and I think we all have coping mechanisms. It's just whether you can identify them or not. What happens if you fail a test? How do you cope with that? How do you talk yourself into being okay with that? Those are all coping mechanisms. You don't fall off the deep end because you failed the test. Maybe you rationalize what happened. Maybe you're calculating up all your points, realizing I'm okay. Just need to do this next time. But there's 2 types of coping. You can see they're in box 19.3 and 19.4. So go look at those when you have time. So a person's capacity to survive and flourish and adapt to healthy coping. If you're not coping well, your health can be negatively affected or negatively affect. It can negatively affect your health. I really apologize. Psychological well-being, you feel good about what happened, about how not necessarily about what happened, but how your stress was handled. And social functioning, performance of daily activities within the context of interpersonal relations and family. Back up here, this word ameliorated. I'm not pronouncing that right at all. I don't know if you know what that means, but it means improved. Improved is what we're looking at there. So our overall goal here for nursing care is to resolve the stressful person, the environment, reduce the stress response, and develop coping skills. That's easier said than done, right? But developing coping skills is probably the number one thing here. The stress responses are going to vary from one person to another. That's true with you guys. I see that in some of you that you're more stressed when it comes to testing than others, and there's different. Each of you have different triggers. So again, a good relationship with the patient is important so you can learn those types of things. Acute stress is easier to recognize than chronic stress. I think chronic stress, we learn to deal with every day, and you just learn to get up and go, and nobody sees that chronic stress. Nurses typically identify stress responses in people or family members who are receiving treatment for other health problems. So this isn't just mental health nursing. You are going to see this in all types of nursing as you're taking care of people. And stress, people in the hospital are stressed. It is stressful to be sick. So the mental health nursing assessment, we've talked about this time and time again. Review of the systems. We're going to write down all their medications. Some things I wrote down here that I think would be different when someone is going through a stressful time is their sleep disturbed? Has their appetite changed? Has their weight fluctuated? It could be up or down based on stress. Their body language, do they look tense? Muscle tension. Ask about alcohol. The book also talks about asking about marijuana, and I think that's important in Illinois, because it's legal now. So it's important to ask about that. Tobacco and any other addictive substances. Again, you always want to ask about herbal medications, over-the-counter things that they may be taking. Psychosocial, focus on the person's emotions and their severity, as well as their coping strategies. Therapeutic communication is really important here. One of the sentences your book said, or one of the phrases your book said is important to say is, let's talk about how you've been feeling. And you may open up a whole book of, they may just word vomit if you just give them that opportunity. So evaluation and treatment guidelines, the treatment outcomes established in the initial plan of care guide the evaluation. So when we are putting together a plan for the patient, the book says we determine a treatment outcome at the very beginning where we want to get to. Individual, family, and network outcomes, so improved health, well-being, social function, maybe their support, improved communication, and modification of the social network to increase support. And that may be, we may all need to do that, modify our social network. I saw something the other day that said, if you ran into this person at the grocery store and you didn't want to talk to them, then they really shouldn't be in your social network online, right? I could get rid of a lot of people if I did that. And this isn't just talking about online. It's just talking about social network, like who they're with. But I thought that was interesting when I saw that. That's chapter 19.